guys, this is Kelly Polshaw. I'm back for my second video to review how to set up an IV piggyback of an antibiotic drug when you're already infusing IV normal saline fluids. So we've just finished putting in a new IV. We've just finished setting up IV normal saline fluids. We're going to move on. So after I'm done cleaning up all that, I'm going to re-perform hand hygiene. I am going to go over my prepared stuff here. So we have our 50 ml bag of our cefazolin, which is 1 gram being given IV piggyback over 30 minutes, where you will be using a secondary IV setup of 10 drops per minute tubing. And when we do the math for that comes out to about 17 drops over the 30 per minute over the 30 minutes. So how we do this is we're going to perform hand hygiene. If you are coming in new to the patient and you are not doing it at the same time you're coming in, you're going to check the IV, make sure that it's running fine, that there's no swelling or heat or leaking or anything going on with the IV site. You want to make sure that that's going properly. In this case, we've just set up the IV, it's patent, and we just hooked up the fluids, so now we're going to hang this. So you're going to open up your secondary tubing. It's going to come with this little guy right here. So this is to help you. So when you are doing a piggyback, your fluids will have to hang lower than your medication. So this little guy right here hangs them lower, so your meds can be hung here and your fluids are lower, because in turn this potentially stops because the gravity from what's up higher is going to push that through, and this will be on kind of on hold until that medication is put in. So we're doing that. You're going to open your tubing. You're going to make sure that your clamp is closed all the way. It's very important that you do this because when you're giving a medication, you can't afford to lose any of the medication or the patient doesn't get the full dose. So it's very important to make sure that your tubing is clamped so you don't lose anything. So in order to prime this, you could prime it like you would this, but I do it differently. I prime it from the fluids bag because fluids we're giving continuously. It's okay to lose a little bit of this versus losing some of the medication that has to be given in the dose. So I'm going to put on gloves because we want to make sure that we are not breaking sterile field. Aseptic technique is important. So when you're giving a piggyback med, you go to the closest port, which would be the first one. You are going to open your alcohol swab, and again you're going to vigorously clean it, port for 15 seconds, make sure you get everything off. You are going to uncap the secondary tubing. Without touching it, you're going to import it to the port and twist so it stays on good. At this point you are hooked up, but you are not primed. So you're going to lower this below the bag of the fluids, and you're going to open your port so that way the entire tube is full. And you're going to do it until the chamber is about halfway full. That is how we do it. Okay, once your chamber is about halfway full, or maybe a little bit more, then you're going to clamp your tubing again. And I see that I'm primed. I still have my spike cap on. So now we're going to take our medication. Again, you're going to invert your bag. You're going to take it off. You're going to take your cap off. You do not want to touch anything. You want to go spike directly into the bag, so that way it maintains sterile. Once you're spiked in, you're going to hang it above your medication. Same thing here. You're going to label your tubing so that way people know when they come in that it's not expired. Today's date, 3 days later is the expiration date, and you're going to initial it. You're also going to label your bag. In this case, I'm using tape, but normally your hospital or place would usually have some type of label that you would fill out with the medication, how much is being given, how long it's being given, what the rate is, and then you would initial it. So we're giving it over 30 minutes. We're putting it on the back of the bag so that way we don't go over the information on the bag. When we do the calculations for this bag, it's 17 drops per minute. So now we're still all closed. We are still hooked up to the patient. We have our secondary primed, and now we are hooked up. But now we have to open the medication so that will go into the patient. You want to obviously make sure that we're giving it appropriately. Again, you're going to have to make sure you have your watch, or some people use a clock on the wall, depending on how you're going to do it. So again, make sure that you review any medication that you're giving with the patient prior to giving it. In this case, we're giving cefazolin. It's an antibiotic. We're going to go over why we're giving it. We're going to go over instructions about things that she can look for if she's having any kind of reactions. We're going to go over, she should let us know if she's having those reactions, how important it is. So we've scrubbed the port, we've gone over our meds. We are now going to open the clamp for our secondary tubing, so that way it can infuse into the patient. So again, because it's gravity, we are going to have to count it. So you're going to open it up very slow. In this case, we're doing 17 drops per minute, so that's even slower than the IV fluids. So we're very slowly going to open it until it starts dripping. Here we go. And we're going to watch our clock for a full minute, and we're going to count the drops. 2. Okay, that's a little fast. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Okay. Now, at this point, we know we are infusing appropriately. Make sure you have no leaks on this IV site. Make sure there's no swelling. You want to make sure you're not infiltrated. I typically usually stay with my patients for 5 to 6 minutes, make sure they don't have any reaction, and then I usually come back to check them, even if I'm doing something else, again, to make sure that they're not having any reaction, just to check in, especially if it's a medication that they have not had before. Some cases with antibiotics, you're going to be hanging it every 8 hours. So you might know, but it's still good to check in and make sure that they're not having any type of reaction. You always want to make sure that when you're done, you clean up your space, that you leave the patient, their bed in a low position with their call bell within reach. Always reassess, and then of course you go into your MARN document. You want to make sure that you're documenting the correct medication. You want to make sure that you're documenting the correct time, the correct route, correct patient, all those things that we do as a nurse on a regular basis. So I believe that's it. We connected one, we connected the other, everything's labeled, expiration dates. Yeah, thanks so much.